All right, everyone. We'll round out our day with a panel of speakers here on corporate medicine. Today, our panel will be consisted of our moderator, Dr. Klees, and I'll take a little bit of a moment to introduce our panelists. First up, we have Dr. Klees. She is currently Associate Medical Director for BASF Corporation, supporting multiple businesses at the corporation since 1995. Her functional responsibilities include the design and management of the BASF Corporation and medical surveillance, medical fitness for duty assessment, and medical audit programs. We completed a residency in internal medicine at Mayo Clinic and residency in occupational medicine at UCSF. One of the other panelists is Dr. Lori Schwartz. She is the Director of Global Medical Operations for the Walt Disney Company. She supervises 4 corporate medical clinics in New York and California, and is the corporate medical consultant for the TV and studio productions for the corporate employees. She is board certified in internal medicine and active member of the Fellow of Occupational Environmental Medicine. She is a Stop Bleed trainer since 2018 and has spearheaded the Stop Bleed training program for a corporate enterprise in the greater New York City area. I also have here Dr. Maloney. He is the Senior Occupational Health Medical Director for North America, Bristol Squibb. He has over 6 years of experience in the pharmaceutical industry and a background in hospital-based employee health. He has also consulted for various industries, including construction, financial services, and entertainment. He is a fellow of the Occupational Environmental Medicine and completed his training at Rutgers and Skyway. Everyone, please welcome right now.
Good afternoon, everyone. This is our last presentation for today, and just before we start with the question, I want to say it's really an honor to be with them, and they are my mentors, and it's a great pleasure to ask them some questions and learn from their experience. So I'm going to start with, we have a few questions, we'll go over them, and we'll start with the first question. Dr. Klees, would you please tell us more about yourself?
I guess I'll stick to, how many hats do I wear? I've been at BASF now for a little over 30 years, which I can't believe. Okay, I'll be honest with you. And I'm the HIPAA privacy officer for that. I do all the contracting for our contract positions. I also sit on 2 international expert groups for BASF. One is Human Health Risk Assessment, otherwise known as IH Expert. You know, mouthfuls and virulence, we try to limit it down. Then I'm also on the Occupational Health Expert group, in which we set up procedures, requirements, and really discuss them, because otherwise we get all kinds of stuff out of Germany that's totally impractical for other parts of the world. So it gives you a little more flavor of what I do. Lori?
Thank you. So I live on Long Island, right out of New York City. Husband, 2 grown kids, 3 dogs. I work in Manhattan, the new Disney building. We moved downtown last year, and we have some live studios there, and you probably know some of the shows. And I also have so I supervise 4 clinics. So one of the clinics is in that building. All nurses. I'm the only doctor for all of corporate TV and studios. And I go back to Burbank, Hollywood, California, about every 2 or 3 months, where I have another 3 clinics. Most of them sit on studios, shows like Grey's Anatomy, General Hospital. And over there too, all nurses, I'm the only physician.
Supposed to follow that? I only have 1 dog. One today. Good afternoon, everybody. My name's Maloney. I won't go through my background and intros. We've already covered that. I've been with BMS now for about 2 years. Been in the pharma industry for about 6. Prior to that, hospital-based employee health. I want to say it's nice to be
home. I'm a Rutgers grad, so I grew up in MARCOEM and coming to these meetings. And happy to be sitting alongside a mentor here as well. And Dr. Klees, going through her course at Rutgers, is sneaking into the next question a little bit, but great mentorship at the MARCOEM group. But just wanted to say I'm really happy to be here, and I recognize we are likely standing between dinner and cocktails, so hopefully we'll have some fun and give you some good insights. We're just grateful to be here, and thank you.
The next question is, how did you get introduced to the corporate medicine?
Okay. I was in college. I took a history of public health course, and I did a paper on Alice Hamilton, and that's how I discovered occupational medicine. So I have a very rare word. I actually kind of about it. It's pretty dumb. And I went to medical school at Maloney, which is now Bristol. And William Weiss, who did the initial description of lung cancer and BCME exposures at Roman Haas, was one of the faculty. He took us on, there was a student elective where we got to go, a week after this, go visit places. Everything from an old asbestos factory in Ambler, Pennsylvania, to Smith Klein Beach, and it was all in one building on Spring Garden Street. And that was really cool. I actually got a chance to spend time at Smith Klein, and that's how I found out about corporate medicine. And I thought it was really interesting, and I got really good advice from one of the physicians there who said, look, you need to go to a primary care specialty first, so you can figure out if it's Lyme or Memorex when you see somebody. And so that's how I got into corporate medicine. Did all the training, all that stuff, but still, that.
And mine is a kind of a strange journey. In 2005, I got a job at ABC. The parent company is Disney, so ABC is American Broadcasting Company in Manhattan. It seemed like an easy job. It was 9 to 5. I had 2 little kids, and it was a weird job because it was a little bit of occ health, a little bit of primary care, or urgent care. There were no urgent care centers back then, 20 years ago. And so treat whatever I can, do a strep test, but don't get involved with drawing blood because you can't do that. Don't send them for x-rays, just do what you can, otherwise send them to their own doctor. Some case management, I was an MRO, and it was just me and a nurse. And we would respond to emergencies, which were usually our audience members, like you guys probably know, you, Live with Kelly, fainting, tripping, they would never eat before waiting online outside to go see the show. So it was kind of an unusual job, a little bit of this, a little bit of that. And then 10 years into it, my boss said, the medical, the clinics in California really don't have a medical director. You want to do it? So I said, okay, I guess I'll get a California license. Why not? So then I started traveling to California, and then I had to drop the primary care, and then it became very administrative, supervisory, writing a lot of policies. So that was like my second 10 years, taking us to today.
So my exposure to corporate medicine, I have really the Rutgers program to thank in its entirety for that. So we had the opportunity, both through mentorship, through individuals coming from different unique industries, do grand rounds at Rutgers, as well as opportunities from a rotation perspective, actually to go and to work in, for a defined period of time at a number of different organizations, predominantly in New Jersey. Additionally, as Julia mentioned, we had through the ERC, we had the site tours and I forget the name of the actual course, but where we had the opportunity to put kind of feet on the ground at different companies, learn about how things operate. So really from an experiential perspective and from an exposure perspective, it was almost entirely the result of the opportunities afforded during my training program.
What are the top 3 skills that help you as a corporate medical director?
Let me also point out that that in different industries you have different exposures and different requirements that you have to become knowledgeable about. Okay, so I work for a chemical manufacturer that is also kind of conglomerate, so we've got, agriculture, mines. I never thought I'd be a mining guy, okay? So I've had to become expert on hazards and issues that affect the businesses that I support. And not only that, look, I'm paid for my expertise and my ability to understand what the business's concerns are. In other words, they're kind of paying me for what's my activities, right? So that's part of it. The other part of it is to have the ability to translate that technical medical information into lay language, right? So medical is getting nowhere, but you can kind of distill it to what the essence is, and understanding that there's all these multiple interests. There's the employee, there's resources, legal, there's management and the direct supervisor, who all have these different perspectives on life, right? And so that helps me a lot to understand where they're coming from. And overall, usually, if you're taking good care of the employee, everybody's interests are served. So I think those are the skills that have really helped.
I'm probably going to repeat one of them. Good communication skills. You have to be able to communicate with the employee, your patient, managers. With my job, I have to learn how to communicate with talent, actors. Yeah, strange. But yeah, it's really good communication skills. Some other things is you have to have a good network, I believe, with colleagues and resources. Since I'm kind of alone, the only physician, I have my ACOM network, I have Dr. Pam Hymel over at Parks and Resorts, so I think that's really important. And another thing I learned, I think in medical school, you need to know your limits, or I think they used to say to me, know what you don't know. So, and just find the answer and tell that whoever's asking you the question, I really don't know, but I'm going to find out for you. Don't pretend that you know it. Just admit that you don't know it. Go find the answer.
I think you both probably drained the topic on this one. Communication, number one. Number two, that I would just add on to Julia, the value currency. So understanding what your unique stakeholders, what they care about, and taking that technical translation of the very difficult or complex medical construct and diluting that down into one, a way that's easily understandable, but then two, putting it in a way that the CFO will care about, putting it in a different way that the HR lead is going to care about, putting it in a different way so the operations folks understand and care about it. There's an influence component as well, but understanding what the business is after and understanding the language the business speaks is incredibly important as well. And I think the last one I would say is adaptability. So from an industry perspective, speaking about pharma, there are constantly mergers, acquisitions, divestitures, whatever they may be. The business changes every day, right? There's different reorgs inside of the business. Something you could be working on yesterday is just no longer important tomorrow. So I think being adaptable, being flexible, and not having your feelings hurt when priorities change and things shift around.
So we talked about the skills. How about what are some of the challenges that you faced as a corporate medical director, and how did you overcome them?
I think there's two flavors. One is communications, and the other is financial. And communications piece is just, I made this mistake, okay, folks? I'll be honest with you. Getting into too much detail, too much technical aspects when talking to non-technical people, and totally losing. Really admit, yes, I have done this. I try to focus on the essence, the who, what, where, when, and why. When I look at a presentation now, I look at it like I'm writing a news article sometimes, to be honest with you. Financial challenges, especially right now, it's a tough time in the chemical industry. And, basically, what can we do to financially justify our existence? Comparing the cost of services provided internally to external vendors, especially when you have critical mass of workers at a given facility, and depending on the complexity of the site. So, and then looking at the geography. and accounting for the indirect costs of sending people away from the site. All those kinds of things are the other challenge of working out methods to address the questions that come. And it just depends on what you do, how you do it, what kind of services you have to provide, what's the regulatory burden, like if you have to do a lot of hazmat exams and a CBA exams, for instance, you know, that's the kind of challenges I think that are really that have been toughest to address.
So my two challenges are on budgetary constraints. I feel like I'm always fighting for something. I had to fight for the bleeding control kits to distribute them throughout the enterprise. So sometimes I'm just very persistent. I just keep asking and asking and asking. And other times I just try to be creative. Maybe I'll split the cost, like do half of it at the end of one fiscal year and the other half in the next fiscal year. Or I start asking around other business units to get my training kits for the bleeding control. I would go to my friends in safety and say, hey, you got any leftover money this year? Could you buy my kits for me? So that's one of them. And then the other one I have, this doesn't have to be corporate medicine, but managing staff, managing my employees. You don't learn this in medical school. You don't learn this in residency. And I find it very difficult at times, different personalities. So you really have to collaborate, really have to work with your HR partners, because it could be very difficult.
The only one I'll add, and this is probably pretty unique from a corporate perspective, but maybe it's not, is it's very easy to be viewed as the school nurse model inside of an organization. Of these are the docs, these are the nurses. If you are sick, that is where you go, hard stop. And there can be very little understanding and visibility into what we actually do with the services that we offer and the value that we bring to the organization. So that's a challenge, because anytime there's budgetary concerns or whatever they may be, you don't generate revenue for the company. We're a cost center. So why are you here? I think is something that constantly from an existential standpoint we have to think about. We always have to be proactive in how we make ourselves visible in other areas outside of this is the dock in the box and basement, which sometimes is to be located in the basement. Another story altogether. But what the way we solve for that is we are always very intentional. And Julia mentioned some of the comparison of outside services. What would you lose if you were to outsource this service? What do you gain by keeping it in-house? And that's just one of the value streams we talk about. But really ensuring that the business and the critical business partners that we have visibility into the metrics that we track, into the successes that we have, into the positive stories and outcomes that we can tell. Why do we accommodate disability? Why are we part of this team? It sounds kind of crazy, right? But you're justifying your existence by demonstrating the value that you bring to the organization. It's something you constantly have to do.
So comparing to like central medical director or hospital medical director, how's your role and responsibility is different than like central medical director?
Define that a little more clearly. There are hospital medical directors like Dr. Beerman who actually serve corporate function for the hospital at the University of Pennsylvania versus a hospital-based clinical practice or a consent. That's what you're really was.
Yes.
So I think the difference is really there's less direct clinical care and there's more focus on developing defined programs that are designed for implementation across multiple work facilities and using multiple providers. I have 120 clinics, more or less, across the U.S. that I deal with. Okay, so I have to get back information that's in a relatively consistent form and format following defined protocols before our program doesn't work. And so designing for that and implementing that is a big difference because we have a lot of small places all over the place, including farms with 2 people. Okay. So, and the whole idea is to preserve the quality and consistency of the medical evaluation for employees. And of course, there are legal ramifications of that in terms of regulatory compliance and ADA compliance for that matter. Is have to kind of apply across the EU and be in keeping with OSHA requirements.
So my answer will be a little different. So for me, it's working with C-suite and non-healthcare people. Everybody I deal with is non-healthcare except my nurses. So that could be difficult. That could be told differently. Sometimes they just don't get it. I think they got it through the pandemic, but most of the time they don't understand me. So sometimes it's hard to speak to them, be relevant to them. Like I said before, I'm the only physician for all of corporate TV institutes, so I find that very difficult.
Only that I will add, Laura, you kind of alluded to it during the last answer, is there's so many more responsibilities outside of clinical duties, and you had mentioned people management and people development. I had no clue how to do any of that. Never went to business school, never learned, even from a developmental perspective. The only exposure I had was watching how people kind of helped me along, what development opportunities I was given. So I think people management is a huge one. And also a lot of just because you are a doctor, because you are a clinician inside an organization, you are still responsible for driving towards the same business goals and outcomes that the company maintains, which may be so foreign to you because they have something to do with productivity in terms of getting product out the door, financial constraints, whatever they may be. So it's ensuring that what you do aligns and you adapt kind of your goals and responsibilities as an individual or department or function to match those of the business as well.
So the next question is more of like a general, but apply for any institution, and it's relevant to what you mentioned, Sean. How do you develop and foster stockholder relationship with your organization?
I think there's a couple things. I like to go to people where they live. I do a lot of site support. I love looking at sites. I love walking the plant. I love learning business. It is great fun. I'm a wannabe engineer, okay? And the thing is, you have to really listen to carefully to their concerns because they're not going to tell you necessarily what the technical problem is because it's a medical component, whatever it is, problem or concern that they got. It's really a matter of listening to them and finding out what the issues are that concern them, and then trying to, get at finding out what really go through an iterative process, I guess, to try to determine what potential options are to solve their issue. And they'll say, "Well, we're here to help." And I had a site manager say to me one time, "Oh yeah, you're here in corporate, you're here to help." And oh, by the way, are you really going to be here to help and answer my questions? So that gets me to the other piece of this, which is really gotta answer your emails, phone calls, pages, text messages promptly. Because that's how you build the relationship, that you're not one of those service centers that never get back to people, but you actually respond. And boy, that goes a long way towards developing relationships.
That'll be one of my answers. I wrote down promptly answered emails. Even if you just say, I don't know, I'll get back to you. I can't stand when people don't answer my emails, and I know they're not that busy. So I hit reply all, and I say, "Hey, did you see this?" And I'm annoying. I'll do that a few times because I want an answer, or just some acknowledgement that they saw the email and they didn't get back to me. And the other thing was, I try to stay relevant, try to be as knowledgeable as possible, try to stay relevant. And I like to walk the studios. I don't walk the plant, but I'll walk around the building. And there's a little bit of fun walking around the studios, like I seeing what's going on. Good Morning America. But I like people to see my face and try to be as helpful as possible. I like them to know also that medical's in the building. I think it makes them feel better seeing me and the nurses that we're walking around. especially during the pandemic that we were there. They were so grateful that, oh wow, you're still here, right here.
Well, no, I have my, stamp on the 35, whatever the heck it is, but it's, back, 30 years ago, it was a pager. Really dating myself. Having fun with it though.
So to add and to build on, visibility is incredibly important. My boss likes to say there's no trade-off for visibility on the shop floor, right? Being seen where the actual work happens gives you such a great amount of credibility with the workers, because then they know and understand that you may not be a technical expert, at least you're making the effort to go try and see how they work and what they do. The piece that I'll add is from a stakeholder, I call it stakeholder management, stakeholder engagement, whatever it may be, nothing gets done alone in an organization. You have to have friends, and there's political components to it, but fine. The piece that I'll add, and I think is the most important thing from my perspective from stakeholder management, is it's an intentional kind of flattening of any perceived hierarchy. So what I mean by that is the white coat and any ego come off when you walk in the doors of whatever organization you're in. And everyone intentionally, I introduce myself as Sean, and I ask them to call me Sean. Tell me who I am, they know who I am. But people don't call me and say, hey, Dr. Maloney, can you help me with, etc. I'm a partner just as much as they are to me. If I need some help in one of their areas of expertise, I'm going to reach out the same way that I would expect them to reach out to me. So I think by intentionally kind of disarming any relationship that they may have had with the healthcare provider, or perceived relationship with a physician in the past, or whatever it may be, that goes a long way to really kind of disarm and let them know that we are all operating on the same page. Your input to the table is the same as my input to the table. Yes, you will ask me for medical advice or whatever it may be, but my input is no different from someone else who's a business expert elsewhere. If you can.
So during my MPH, we used to have like a course called site visit, and we go every week to different visit at the place. And initially, like when I read the title, like, what I'm going to learn about that, and you learn much more than any textbook. And that's like one of the things that I've done when I started working, is like go there and watch. If you're in the hospital, go and check. If you have signed in, after the sign in, sign out, go and check the room. You would learn a lot. That brings us to the last question is, and we have people, students, residents, people in their early career, mid-career, or even at their peak. What's your advice for people who would like to enter that field?
Depends where you are in that career. I mean, for instance, for residents coming out, I don't know if I said this, go get some practice experience. Go work at a, hospital-based employee health clinic. Something along those lines. Once you're out of your whole training cycle, but don't into the residency. Let's say, and you've been in practice or things that really come out of something. You want to really get that exposure to seeing.
But if you're interested, just take a look at it.
I see. Because
It's pretty quick reading. Yeah. But he developed his own the development of India. Pretty cool. Yeah. Pretty cool.
But if you want clarification here, this is not for you. All right, I will tell you, you will be possibly bored out of your mind if you really like, patient care, and or like I hired nurses who have been in the ER, but they have to be burned out from the ER. Okay, they have to be past the adrenaline rush. Because the role is administrative and building systems of clinical practice, quality assurance, and emergency medical response. Do not forget that we run emergency medical response in our facilities. We are medically controlled for the first aiders and first responders. So that's another piece that you probably won't have if you've been in the regular clinical environment.
It's interesting how you say it's not clinical. I do miss it. So sometimes when the nurses see the patients, sometimes I go in the exam room and I'm not even invited because because I miss, or maybe it's one of my friends. I just notice like, hey, what's going on? It's not like the nurse even called me in. I want to be part of the patient, physician experience. So I do that once in a while. And the nurses look at me like, why are you here? I don't need you. But I miss it. I would advise, joining medical organizations, join ACOM, MARCOEM, go to conferences whenever you can. Try to get the company or someone to pay for the conference, and do those site visits too. I feel like I didn't do enough of the off-site visits. I think they're so important. So I'm going to try to do more of them when I go to AOHC. And another thing I like, I think you do some good networking, LinkedIn. So I do enjoy LinkedIn. I get to meet great people. Like they'll communicate with you on LinkedIn, and then you meet them at the conference.
So I'll add two. I'll keep them short, and they're probably more geared towards earlier career, just because I've only been in the industry for about 6 years now. The first one is if this is something you determine that you want to do, you have to be relentless in your pursuit of it, because you will hear people that will say those jobs don't exist, that people don't actually do that. You have to be hell-bent on getting what you want. And that means not taking no for an answer, seeking kind of opportunities that may or may not feel like they are directly related to what you want to do, but you can kind of utilize those to springboard you to a new role. One of the first roles that I took at prior organization I was with was actually geared and tailored towards an EHS professional. And I applied for it anyway and talked to the recruiter and kind of convinced them that, no, you really need an opt out for this. They changed the grading, and then that's how I got that job. You have to be influential in that way, and you have to fight for what you want to get. And I think the second would be, someone gave me this bit of advice when I was starting my first job out of residency. It's bloom where you're planted, right? So I worked in a hospital-based employee health setting and knew I wanted to work in corporate. You could sit there and do your clinical transactions and just kind of say, I'm doing what I need to do to fulfill my job duties, but you really need to seek opportunities that when you put them onto a resume are going to shine through as skills and opportunities that you took to display that you have the right skills to work in that industry or wherever you're applying. So, Hassan and I talk about this all the time of, what are the things that are kind of tangential to your job that you can volunteer for, whether it's committees, whether it's leading, QI initiatives, whatever they may be. It's a stretch outside of the kind of standard job description that you may have, but it's the opportunity to demonstrate that you are capable beyond what you're currently doing.
And Sean, just so everybody hears this, one of the tangential things is volunteering at MARCOEM.
How do I get a voluntary job?
I'd like to add,
Give it to you.
I started out there with a lot of the companies have, well, first of all, there's more manufacturing, all right? And then there was also more direct employment of position. And that has steadily decreased. So what corporate jobs there are, you have to look long and hard, and you have to really keep your eyes wide open. And, and then just be after it. If this is something you think you'd like to do. And it does help if you've done, some consulting for a company out of practice, or if you, when I was at Jefferson Medical College. I actually been employed at Weston and did a lot of consulting hospitals, especially regarding their pathology, looking at exposures in those labs, and that's all transferable skill sets that you can develop where you are currently, if this is not something you want to do. So it's important to continue to develop your skills. No matter where you are. Certainly, coming to conferences is important. So, taking advantage of all of the opportunities that may present to you.
Folks, we're gonna open it for questions. If somebody have.
Wanted to ask, for those who are considering corporate medicine, how important is it to have a financial acumen? Is it getting an MBA or taking courses?
Well, let me put it to you this way. I have some financial acumen, but I do not have an MBA. I got it by working with my family business. And I still work I also do all the bookkeeping and planning for my family's business right now. Actually, still, amongst all my other hats.
I think it depends on the job. I mean, I manage my budget, but I don't need a business degree and finance degree. It'll depend on the job description, whether you have to manage budgets. So to me, it doesn't matter for my job.
It also depends on if you have a controller or not who works with your group. Some companies, the corporate medical director has a quote administrator who does all that for them. We do not. I am not only medical director, but I am the line manager, so to speak.
You'll be surprised to know that we're very good friends with our finance business partner, because none of us are trained in finance on our team. But no, I agree. A basic knowledge from a budgeting perspective has served me well, but beyond that, have not had to have any type of formal background from an MBA perspective.
Sean mentioned to me previously, there is 10 days MBA course that you can take. So I learned through the
Marcelo Targino recommended that one. It's a great book. And I think I'll tell you the chapters that are important to it.
My advice, if you have the time and energy and have some time, go and do your MBA. It change your aspects of things. I did my MBA a few years ago. Nothing related to medicine, very outside of medicine, and I will tell you that was one of my best decisions I've ever had, and it helps you a lot in different aspects.
So I will attest to Hassan, as the co-chair, his financial acumen allowed us to do a lot of things as far as getting sponsors, and just looking at the financial picture that we really hadn't done prior to this. So I curse you for it, but thank you.
Thank you. I have a question regarding providing primary care services, and maybe you do or maybe you don't. The challenge that I have, so I'm with Pivot On-Site Athletic. We've changed names probably 5 times since I've been there. One of the challenges that we have is separating the non-op with primary care and billing because of ERISA. And you have your Medicare patients, your HSA. How do you get around that?
Don't do it.
Yeah.
And I know that's not the answer. Actually, I will tell you, we made a very clear decision not to do it, at least at this point in time. And also, benefits has ERISA, we're self-funded on that side. The cost savings were not felt to be there for the overall enterprise to, to provide additional funding where we have clinic to provide primary care. We do, however, do first aid triage, and we will, if we identify an individual, let's say, as super poorly controlled hypertension, to actually help them with getting their physician, nurse, and staff knows that they absolutely should make that call to their provider's office and try to increase the deals to get them to care promptly. So that's how we do it.
Yeah, that's how we deal with it also, triage. It used to do a little bit of primary care, but when I got 3 more clinics and travel, I just saw it was a big liability for me and the company. You know, like you would say give an antibiotic on Friday, and I was only 9 to 5, and then I'm off to California. You couldn't reach me, so the patient can't reach me. I just don't think that was a great way to practice medicine. So I gave it up because of travel and the increased liability.
Completely agree. I think I've only seen or heard of 2 organizations doing it really well, and it is completely firewall from a standpoint of who the provider is providing care on either side, and literally there's a wall between the 2 spaces. So it's in primary care on one side, in for occupational health on the other side.
How do you ensure the continuity of care? That's the real question. Because we had talked about it at 20 years ago, and we revisited it again in areas where, you know, the nearest medical providers are a good hour drive away. So the way we do it kind of works reasonably well for us.
Yeah, I was taught a long time ago, just because you can doesn't mean you should.
Yeah. All right, thank you. I think it's been a very interesting panel. I think when I looked at the schedule, this was one of the highlights, especially because I saw Walt just came up. So my questions are very related to that. During the pandemic, I'm interested to know what kind of strategies you use to kind of steer the affairs of the company. And you did mention a few times you're really dog. Are you still looking for new dogs? Okay.
So I have the corporate and the TV and the studios. We have a lot of studios. So I don't handle parks and resorts or cruise line. So we had many meetings with health safety managers, and we also had guidance from the unions. The unions had all these protocols. So myself, health and safety, we all work together to get through all those protocols and keep everybody safe, but also we had to get the business up and running because we lost a lot of money in the beginning because all the shows were stopped. So it was just a big coordinated effort to get those protocols and stick to those protocols, and it was really difficult because we had many productions that they went down for several days. I heard sometimes if you're down for a few days, it could be like $1 million loss to that show. So it was just like this big coordinated effort. It can't be just on me. It's got to be every health safety, HR, medical, a lot of people to make it work.
No, we didn't shut down. We were an essential industry. So guess what? That disinfectant and those soaps, we make the basic chemicals for those. Yeah, so it was lots of fun. And you know, at BASF we do crisis management. We have an incident support team. On incident support is all the assorted functional groups: legal, HHS, medical, HR, everybody came. And we fortunately, because of the pandemic, was able to last one that you had certain criteria, and so basically we adapted that, filled in the blanks, put together the screening protocol before the shutdown. Because I was going on vacation, I was going skiing, and I said to my senior nurse who with park management program, you know, we need to like get some stuff together, and we had people coming back from China during the initial reports because and we have several of our labs who have a pretty significant population of Chinese nationals who were coming back from China. So we were keeping temperature logs and had a whole screening protocol for those folks before the shutdown. And so when that occurred and we still had to keep running, guess what we did? We just rolled it on out and started pulling together all the different pieces that we worked on before. And because of that planning, we were really close that most workers in our corporate headquarters and in the labs and the businesses already had laptops. So we could keep the company running remotely unless people had to be on site, because they had to be, because no, you just can't shut down the hardwood plant, you know? So that's kind of how we approached it, and what we did, and then as we gradually reopened some of the labs and business offices and so forth, each of those sites had to have a reopening plan with guidance to them, with what the elements had to be. And we also had to work on guidance for people going in vehicles to crop sites, for that matter. We normally haul a whole bunch of people in a van. Nope. And then deal with that too. So anyway.
Nothing to add, just has to be multidisciplinary, can't make decisions in silos and situations.
If I recollect, Dr. Schwartz, you guys did pivot with those money losses and had the NBA down in Florida alone, so making money off of the television thing.
Exactly. So we got to, we get a round of applause for that.
Thank you very much. We gonna be here tomorrow morning. Looking forward to see you and hope you enjoy anything.